Hi, my name is Dr. Laura Knight and I'm a dermatologist. Today we're going to be discussing pigmentation. So pigment reflects the color of our skin. When we say pigmentation, we're usually referring to an abnormality in that color. And that abnormality can be an increase in pigment, which we call hyperpigmentation, or a decrease in pigment, which we call hypopigmentation. So today we're just going to be looking at hyperpigmentation. So hyperpigmentation occurs from one of three causes. The first being sunspots, where, as the name implies, increased sun exposure results in an increase in pigment in the skin. The second one is post-inflammatory hyperpigmentation, where any cause of inflammation, be it from a skin condition like eczema or psoriasis, from trauma, from laser, from waxing, causes an insult to the basal layer, so the bottom layer of our skin, that results in the pigment going into the deeper layers of the skin, and then we see that as abnormal pigment on the skin. The third cause being melasma, which we typically think of as being hormonal pigmentation, and melasma presents as brown or grey patches over our upper cheeks, upper lip, chin, and also forehead. It's important to remember though that melasma is not only hormonal, although we see it more commonly in pregnancy and with the use of the oral contraceptive pill, it can also occur in men. So while pigmentation is often quite distressing to the individual, it's actually harmless, and we purely treat it obviously because people don't like it or you don't like it, and there are treatment options available. The thing about pigmentation is that it's very difficult to treat, and it requires a lot of buy-in and a lot of discipline with your maintenance of your treatment regimen, but also sun avoidance. And important to remember that even just 1 or 2 days of loving life, living out in the sun without sun protection can set your whole treatment regimen right back to the beginning. So my first point is that the most important treatment of pigmentation is avoidance and prevention. So sun protection in the form of hats, seeking out the shade, and also using appropriate sunscreen. So your sunscreen should be at least SPF 30 with UVA and UVB coverage, used in appropriate amounts and applied throughout the course of the day. So then we get to our treatment modalities. So as we've already explained, there's different kinds of pigmentation, and individual pigmentation may be deeper or more superficial than others. So it's important to have your pigmentation evaluated to devise an optimal treatment regimen for your pigmentation. So there are a number of topical treatment options, which are treatments that you can apply to the skin. And many of these you actually don't need a prescription for. So they're either over-the-counter or off-the-shelf kind of products. And ingredients to look for would be vitamin A, so your retinoids, vitamin C, azelaic acid, and kojic acid. Then some topical treatments which need a prescription, which would be your prescription strength retinoids, and also dermatologists can provide depigmenting cream, which includes glutathione. On that note, it's very important to avoid IV glutathione drips, as although they seem like this quick promising solution, they've got a lot of side effects, not only just worsening your pigmentation, but also systemically. Other options which are useful for pigmentation, especially deeper pigmentation, include things like chemical peels, either with retinoids or TCA, and even in some instances, light or laser therapy can be used for pigmentation. So it's important to have your pigmentation looked at and to be very, very diligent about your pigmentation treatment, but also about your sunscreen protection and preventing any worsening or darkening of your pigmentation.